Medicare is spending big bucks on patients receiving long-time care at nursing homes. Ultra-high therapy, as it's known, generates some of the biggest payments from the taxpayer-funded program. WSJ's Anna Mathews joins us now with the details. Hi, Anna. So tell us exactly what ultra-high therapy is and what duration of time qualifies it as such.
Well, Medicare measures it in increments of minutes per week. So to get to the ultra-high level, which is where you typically would get the biggest payments from Medicare, a nursing home or a skilled nursing facility, as they're called by Medicare, would need to get over 720 minutes or more in a week. And then down from there, there are different levels of therapy which are paid sort of correspondingly less as they do fewer minutes.
And what kinds of therapies are we talking about here?
We're talking about occupational therapy, physical therapy, speech therapy, a lot of things that are helpful for a lot of patients. The question that we got when we talked to a lot of experts, though, is whether all the patients who are getting this much therapy really need this many minutes of therapy.
You found certain cases of patients who were suffering from dementia in certain cases, and their own family members were surprised to see that they'd received so much of this kind of therapy?
We did talk to the family of a now deceased patient, a late patient, who was the daughter was surprised that he was getting as much as 3 hours of therapy on some days, despite being weakened and having dementia. We also talked to a lot of therapists who work in facilities across the country, many of whom described a pattern of being pushed to get to that 720-minute mark, the ultra-high mark, so that the payment would be higher, even if they questioned whether a patient really needed it, and even if a patient refused or didn't want that much therapy and was pushing them away, they were told to come back and keep trying to get to that 720-minute mark.
Are there ever any instances where this kind of therapy can actually be detrimental to a patient?
It's an interesting question. I don't know if there's research that pins that down definitively, but anecdotally, in talking to some therapists, they did sometimes feel that patients were getting therapy to a level that not only wasn't beneficial, but might even potentially be detrimental. One example is that some felt that when a patient came to the skilled nursing facility right out of the hospital, might still be in pain, might still be, not completely themselves after surgery, they were already being pushed to do many minutes of therapy right away, rather than ramping up to a higher level, perhaps when a patient was in a better state.
Now, if we are to put a dollar number on what these nursing homes are getting paid by Medicare for a day of ultra-high therapy, what would that look like?
Well, what we calculated based on the data was around $560 a day on average for the ultra-high level. That was for 2013 data. Overall, Medicare spent $28.8 billion last year on skilled nursing facilities.
Now, Medicare adopted this payment system in 1998, correct, and slowly phased it in. What caused them to change the system in the first place?
Medicare is always trying to incentivize good care and to match what they pay to what patients need and what nursing homes are actually doing. They moved from paying based on costs, which had its own issues and problems, to this system. But there has long been concern by experts and by outside agencies that monitor Medicare that this system now has created a setup where patients are perhaps getting unnecessary therapy, in some cases where nursing homes are incentivized to do more and more therapy, whether or not a patient actually needs it clinically.
So are there efforts now to look into this and perhaps change the process going forward?
Medicare is certainly aware of the issue, and they've tweaked their payment system many times over the years to deal with various concerns. And they've said overall, broadly, they want to move to a system that rewards efficient and high-quality care. So they are aware of this issue. And again, outside agencies that monitor Medicare have said, despite years of efforts to change it, this incentive still remains.
All right, Anna Mathews, thank you so much for all of that.
Thank you so much.